Hi and hello everyone. A very good morning to all of you. For the record, this is a pre-recorded session, webinar session, and this will be the second webinar session for the Research and Innovation Department. So today, before I go into my topic, I would like to tell that previously in our first webinar session, our director has presented on leading an active lifestyle during MCO. What tools do we have? So in today's presentation, my colleague and myself will be presenting about elderly exercise and also exercise for children. So this will be a follow-up from that particular webinar session. So let me, without a delay, let me go into my topic today. So my topic today will be Stay Active Senior Staff, or we call them as older adults, a 15-minute chair exercise. This is the tools that we're going to look into today. So why is it matter, first of all? So the recent pandemic has the potential to cause significant physical and mental damage in older adults. So people with older adults, they used to move around to maintain their muscle mass and so on. So if they do not do this, especially during this pandemic, movements are restricted, they are cooped into a small space, which is their home or anything. So that makes them lose muscle mass. Their VO2 max will be dropped, which means their cardiovascular fitness will be dropped, and there will be some changes in hormones as well, which will affect their physiologically and also psychologically, and also they might face some muscle and joint stiffness as well. This could be worsened if our movement is restricted. Generally, for a person to be active, the minimum step count is the recommended step count is more than 10,000. If anything above 7,000 to 10,000 is considered like moderately active. During this MCO period, your step count could be reduced drastically. It can go as low as 3,000 to 4,000 per day because you are just in a small space. So there are studies show that it has been shown that 2 weeks of daily step reduction, more than 1,000 steps per day, contribute to not only the loss of muscle mass and strength, but also they impair the glycemic control and inflammatory status. Now this is very important because in Malaysia we know that we are facing a serious obesity and metabolic diseases problem. Our diabetic rate has increased more than 20% over a decade. So this is a serious issue, and with the movement of control, this MCO effect comes in. There could be more potential older adults which have impact glycemic control problem, which will lead to them to hypertension or diabetes and so on. So that is the reason we would like to address this situation now. So let us look into some basic general benefits that what they will benefit if they continue exercise or do any kind of exercise for older adults. So some physiological benefit of physical activity for older adults. This is from ACSM. So for immediate effect, if they do exercise, they can regulate their blood glucose. Both adrenaline and noradrenaline levels are stimulated, enhance their sleep quality and quantity. So the quality of the sleep is very important for older adults, and also improve bone health. Why I highlight the bone health is because generally when you are getting older, you will start to lose the calcium from your bone, which will make your bone more fragile. That's why older adults are more prone to bone fracture and so on. So how do you keep your bone mass intact or compact is by putting stress on them. What do you mean by putting stress on them means you put load or resistance towards on their bone. So this will indirectly maintain their bone mass. So this is very important why older adults should remain exercise and active. So some of the long-term effect, if let's say there are many types of exercise that we can do, in terms of aerobic exercises, the improvement of all aspects of cardiovascular functioning. If people who are doing resistance training or muscular strength, they could muscle strengthening can have a significant effect on the maintenance and independence in old age. Flexibility, prevention and restoration of flexibility, and balance and coordination, prevent and or postpone the age-associated declines in balance and coordination that are major risk factor for falls in older adults. So in relation to COVID-19 or this MCO period, the evidence show that regular exercise improves immune function and can potentially protect older adults from infection. So this is why we want to stay active and do exercise, because many studies have proven that exercise improves immune system. So while we are finding for vaccine and all that, we know that naturally our body could produce, if our own body can produce an antibody and we could fight the virus, we are safe. So that's why we should maintain this exercise. So some of the psychological benefits, we're not going to look into detail, but we will just generally look into some psychological benefit of physical activity for older adults. Some immediate effects are relaxation, reduced stress and anxiety, and long-term effects are general well-being, improved mental health, cognitive improvement, which means muscle memories. They could remember things more compared to normal time, because when you get older you tend to forget things faster. So this will improve in their cognitive improvement, motor control and performance, and some skill acquisitions. So now let us look into the type of exercise. There are many types of exercise that older adults can engage into, and some of the major ones are like aerobic or endurance exercise. For today we will be focusing on resistance or strengthening, and some flexibility and stretching, stability and balance. So there are some alternate exercises as well, which comprises of aerobic and some strengthening and balance and flexibility and all that. So those will be like yoga, qigong, tai chi and so on. So some people do practice that, so keep going. So these are some evidence that shows that all these alternate medicine do support, okay, or there have been ongoing studies even during the pandemic season on these alternative exercise methods, which benefit all these patients who are infected and also as a prevention treatment. So what are the what activities strengthen muscle? Today we're just going to look into the resistance exercise. So what activities strengthen muscle? There are many ways you can strengthen your muscle. One of them is the most basic, lifting weights. You go to gym, you hit the gym, you carry dumbbells or any weights, that will be. But this is a bit probably not suitable for those who could not access to any gyms, or you don't have any gym access and all that, or for older adults, generally 60 and 65 and above, who do not prefer to carry weight. And also working with resistant bands, instead of weight dumbbells and all that, now we have many kind of resistant bands you can do at home, and doing exercise that use your own body weight like push-ups, sit-ups and so on. And chair exercise can be done at home. So this is our focus today. And then some general activities that you can do at home, like gardening, digging, shoveling and all that. This can be also strengthening your muscles. So who should participate in this is people who are older adults who age 60 to 65 and above. Generally anyone can do this exercise, but this is specifically for older adults, so the intensity will be lower and we have modified to become more easier. So just for the record, in Malaysia, if you are 60 and above, you are considered senior citizen. But in a developed country, socio-economically like US and so on, 65 and above is considered older adults. But generally we know that age is just a number, and everybody has a different aging process based on their physiological strength. So we should analyze and define at which stage we are now. So next is healthy, no chronic diseases. People with no chronic diseases like stroke, cardiovascular disease and so on. So we do not recommend this exercise to people with chronic disease, because these people only should engage after get some clearance from their medical practitioner, GPs. And free from any metabolic diseases like diabetes, hypertension, because if you are having diabetes and all that, high chances if you are doing any activity you might collapse. So it's best to do exercise with the guidance from the doctor. and no severe back pain and other joint pains. Especially for older adults, they are very prone to have back pains and joint pains. So it is not recommended if you have severe, for example, like knee pain and so on. So now we will go into the 15-minute strength exercise. This whole process of exercise will take about 15 minutes only. Okay, you can just do it at home with simple clothing, no shoes required. Just wear your shorts or tracksuit and with your simple t-shirts, and just do it at home with one chair. So the chair that we're going to provide, make sure when you use the chair, it must be a well-supported, strong chair, because we don't want the chair to be wobbly. It might affect or it might injure you during the process. So without a delay, we will demonstrate all the exercises that we're going to do. Now we will look into our chair exercise. We have total of 10 chair exercises. So first exercise is a sit to stand. So for this, for most of our exercises, we need a simple chair. You can have a simple chair as this, and must make sure that there is a stable chair and it's not so wobbly. So just to make sure we are safe during the exercise. So first, sit to stand. What you have to do is sit on the edge of the chair or half of the chair with your feet and hip width apart. Lean slightly forward and then stand up slowly using your legs, not arms. Keep looking forward and do not look down. And then stand upright and then slowly sit down. So while you're sitting down, your bottoms first. So repeat. 1. Okay, sit. Okay. Usually you can put your hand at the hip, and if let's say you find it difficult, and you can always support your hand on your quadricep. So you can push and then slowly go down. You can repeat this sit to stand about 10 times, but if you find it difficult, you can always start slow, about 3 to 5 reps, and you can do about 3 sets, 2 to 3 sets for each time. Okay, now we go into the second exercise, which is half squat. Half squat, you go at the back of the chair and rest your hands on the back of the chair for stability, and stand with your feet hip width apart as usual, and then slowly bend your knees as far as it is comfortable, keeping them facing forward. Aim to get them over your big toe. Keep your back straight at all times. Okay, make sure your back is straight and gently come up to standing. Okay, this is half squat. You may repeat this standard about 10 times. If you want to start slow, you can always start from 3 to 5 repetitions, and you can also do 2 to 3 sets each time. Our third exercise will be calf raises. For this, you rest your hands on the back of the chair for stability. Lift both heels off the floor as far as it is comfortable. The movement should be slow and controlled, and then slowly touch the ground again, and then repeat. You can do about 10 to 12 repetitions and 2 to 3 sets. And if let's say you want to perform this or increase the difficulty level of this exercise, you can simply lift off your end of the chair and do it freely without support. So this will increase the intensity of the exercise. Our fourth exercise will be sideways leg lift. Rest your hand on the back of the chair for stability as usual. Raise your left leg to the side as far as it is comfortable, keeping your back and hips straight. Avoid tilting to the right. Return to the starting position. Now, raise your right leg to the side as far as possible. Raise and lower each leg slowly and about 10 to 12 repetitions. You can also do this 2 to 3 sets each exercise session. Our fifth exercise today is leg extension. So same goes, rest your hands on the back of the chair for stability. Standing upright, raise your left leg backwards, slowly keeping it straight. Avoid arcing your back as you take the leg back. You should feel the effort in the back of your thigh and bottom. So repeat the same thing with the right leg. Hold the head, lift for up to 5 seconds, and repeat 10 times with each leg. You can always increase the repetition or decrease according to your own pace, and you can also do this 2 through 3 sets for each exercise sessions. Our sixth exercise today will be wall press up. It is a modified push-up basically. Stand arm's length from the wall. Place your hand flat against the wall at chest level with your fingers pointing upwards. With your back straight, slowly bend your arms, keeping your elbows by your side. Aim to close the gap between you and the wall as much as you can. Slowly return to the start position. Attempt 3 sets with 5 to 10 repetitions at your own pace. Our seventh exercise is bicep curl. This is pretty much an easy exercise. And for this, you need a pair of dumbbell or very lightweight dumbbells if you have. Otherwise, you can always replace with 2 bottles of water filled with waters. And you can always stand with your feet hip width apart as usual, keeping your arms side by side. Slowly bend them until the weight in your hands reaches your shoulder. And then slowly you can lower the weights to the full range of motion. You can repeat this exercise 10 to 12 times, and then you can always do 2 to 3 sets for each exercise session. You can also do this exercise while sitting on the chair. Our 8th exercise will be knee extension while seated on a chair. So sit at the edge of the chair with back straight in position. Okay, keeping your arms side by side with grip on the chair firmly, and then extend your knee 70 to 80 degree. So do not overextend the knees. So just use your range of motion and comfortableness. Usually around 70 to 80 should be fine. And from the ground, you lift about 70 to 80 and then slowly back to the ground slowly. Repeat on both limbs. So you may repeat this extension 8 to 10 times with 2 to 3 sets each exercise sessions. Our 9th exercise will be sitting overhead press. So sit on the edge of the chair with back in a straight position. Hold a dumbbell or bottles filled with water in each end at the shoulders with an overhead grip. Raise the weights above the head in a controlled motion while exhaling. Pause at the top of the motion, and then return the dumbbell or bottle to the shoulder while inhaling. You may attempt this 8 to 12 reps for 2 to 3 sets. So the last exercise for today will be seated row. So for this, the subject should be sit on the end of a bench with your knees bent, feet flat on the floor, and place a pair of bottles or dumbbells on the floor at your sides. And then you can slowly grip them, bend forward at the waist as far as you can until your back is almost parallel to the floor. Your chest should touch your legs. Reach the weights and then slowly lift your arm. Without moving anything but your arms, slowly pull the dumbbell or weight up to close to your body to the side of your chest. Hold for a second, then lower the weights back. You may attempt this 5 to 8 repetitions, 2 to 3 sets each exercise sessions. Okay, so during after the exercise, let's say you during the exercise period of 15 minutes, for older adults especially, how do you justify the intensity? Because we have given you the set and repetition, how many times you can do, you can follow your own pace. But how about the intensity? Intensity can be varied according to age group and individual. So I advise personally use the rate of perceived scale 1 to 10. This is one example. You can just simply Google and get some guidelines. So from 1 is the very light activity until 10 is the maximum effort activity. So after each exercise, you can rate yourself where you are now. So if let's say you are touching above 8, 9 or 10, I advise you take a step back. Probably you want to do some relaxation and then you may continue, or you may discontinue the exercise. So this can be a guideline instead of just continuously doing. So next, this is a general workout plan that I have roughly designed and modified. So in a week, what an older adult can practice is every day he must at least engage in a 15 minutes or 30 minutes aerobic activity. So we break it into, maybe for Monday you can do a 15 minutes walk, and then you do a strength exercise in the evening, about 15 minutes, for example like chair exercise, or you can replace with any other strength exercise that you would prefer. And also you must always include balance and flexibility. Balance and flexibility is very important for older adults. So we recommend balance and flexibility throughout the day, every single day if possible. And then the next day, and strength exercise, we recommend you to do 2 to 3 days maximum, and in between rest. So you can always take a break in between the days. So either 2 or 3 would be very good for resistance exercise, and a rest day in between 2 to 3 days once. A rest day can always go with balance and flexibility because it's a very low intensity and it's just a relaxation. And finally, we have come to the end. Some take-home messages. So what is the aim? Is to be physically active every day. That is our ultimate goal. Any activity is better than none. You can do any activity. Doesn't mean you have to do any structured exercises. Even as simple as gardening, car washing and all that is considered an activity. Do activities that improve strength, balance, flexibility on at least 2 days a week. Okay, these are the recommendation, but we would recommend more than this. Do at least 150 minutes of moderate intensity activity a week, or 75 minutes of vigorous intensity activity if you are already active, or a combination of both. So this is a general guideline by WHO, ADA Association, ACSM and all that. So 150 minutes can be break down into 30 minutes for 5 days, or you can do it together. Okay, it's always up to you how you're going to break it. Even a 30-minute exercise in a day is a minimum requirement. You can always break it into 15 minutes. 15 minutes of aerobic, 15 minutes of strength in the day and the evening, like how we prescribe in the workout plan. So it's always up to the individual, but at least we reach a target of minimum of 30 minutes a day. And then reduce time spent sitting or lying down, and break up long period of not moving with some activity. So previous webinar series, probably you would have looked into what are the adverse effects that you will get if you tend to sit more than 8 hours or 12 hours per day. So there are many things, including metabolic changes in our body, and we know that during this MCO period we tend to sit more and watch TV or work from home. We tend to sit in front of a laptop and all that. So even in a general working day, we tend to sit 8 to 12 hours. So just imagine if you are under a restricted movement period, probably we would be sitting 12 to 16 hours easily a day. So this is a very bad situation for every one of us, so including the older adults. So we must cut down this time spent sitting down or lying down. Instead, maybe we can just walk around in the house itself, or going down the stairs and up the stairs and so on. Some of them even taking a marathon challenge inside their own house. So anything is possible. If you have fallen or are worried about falling, doing exercise to improve your strength, balance and flexibility will help to make you stronger and feel more confident on your feet. Speak to your GP if you have any concern about exercising. So I would like to thank Dr. Yo Wee Kian, our Director of Research and Innovation Division, my research team, Translational Research Group, and also our supporting group, our ISM Video and ICT team. Thank you for all the frontliners as well. Thank you.